Oftentimes I talk to patients and we've taken some pictures and we can show their teeth, and they've got wear patterns, or they even have some chipped areas from grinding, and still people will say, I don't want to wear a retainer at night. I get that. And I actually wear a night guard, and I've worn one since I learned about it in dental school, and decided, oh man, that's me. I went that afternoon and made a night guard. So I understand who wants to wear a retainer at night? Nobody, and who wants to pay for one? I get that, but something that we have happen that happens more frequently than you would think is a patient will come in, and I'll talk to them about it, and they'll say, okay, I understand that, but nothing hurts. I don't want to do that. That's fine. And then they'll come back 3 or 4 years later, and they've chipped a tooth, and they're like, okay, Rick, fine. And I'm ready. Let's fix the tooth and give me that night guard. And the funny thing is, now the guy was reluctant, and I understand that. But when they come in for their 6-month cleaning, this is kind of interesting to us. The guy will come in and go, hey Rick, that thing that you got that I'm wearing at night? I said, yeah. I went on a weekend trip and I left it behind. I really missed it. So here's a person who's reluctant, but boy, once you start wearing it, it's your muscles are more relaxed, and you just don't get any more wear to your teeth. So it really helps. But at first you think, I wouldn't want to wear one of those, but once you do, yeah, you find that's easy to wear.